And Aisha, there's been so much talk around the NHI, so much criticism. What did the Cabinet outcomes have to say about that?
Well, according to Minister Mthembu, the NHI bill is, of course, now before Parliament, and he says that Cabinet supports the NHI bill. He says it is now an opportunity for the public to once again engage with this bill and to talk about their concerns. But he did say that Cabinet supports this bill. It is an opportunity for all South Africans, regardless of their socio-economic circumstances, to be given universal and quality health care. Now, he says that that government and Cabinet is aware of the fact that there will be challenges and that people are talking about it being unaffordable. We heard last week from the leader of the opposition party, Mmusi Maimane, talking about the fact that this is not, the NHI bill is not the way to go. It's not going to work for South Africa. It's going to lead to wide-scale corruption. But Jackson Mthembu says that this is a responsible government, that government is aware of the challenges facing, and that the bill, once it is passed, will be done in a responsible manner and it will be phased in.
Yeah, there's still a long way to go, as I understand it, Aisha. Still public participation and a lot more to go before the NHI is finalised. But before we let you go, this new district-based service delivery model, that was approved by Cabinet. What does that entail?
Well, it's quite interesting because a lot of questions from journalists were asked about this, and basically what the minister said was that all three spheres of government will be involved. So for me to give you a simple example, let's assume they build a clinic or a hospital in a remote area. It wouldn't make sense for them to build a hospital or a clinic and not have transport to the hospital or not even have a road to the clinic. So what's going to happen is that all three spheres of government will be monitoring what will be happening in these districts. And he also talked about a war room that will be monitoring projects in the district. So it seems as if they've got it worked out, and that there's going to be monitoring on a national level as to what will be taking place in the districts. And he says, of course, this is all aimed at improving service delivery for all.
Yeah, it looks very good on paper, but of course, as we know, it'll come down to the implementation. Thanks very much for that, Aisha Ismail. Live to us there from Parliament.